Next tonight, and the debate on the cervical cancer vaccine continues.
Following the case of teenager Natalie Morton from Coventry, who died shortly after having the jab, some primary care trusts in our region have suspended administering the vaccine in schools.
Now, health bosses are reassuring parents that the vaccine is safe, but there are still some who are unsure about its benefits. Tom Barton reports.
Preliminary post-mortem results last night showed that it was most unlikely that Natalie Morton's death was caused by the HPV vaccine. But the effects of the 14-year-old's death after being given the Cervirax injection are still being felt in our region. Milton Keynes and West Essex primary care trusts have suspended administering the vaccine in some schools so they can reassure parents that it's safe. Meanwhile, the North East Essex Trust was forced to halt its programme after it emerged it was using the same batch of vaccines that Natalie was given before she died.
We've reordered more, but more has been made available to us now, so we're able to restart the vaccination programme as planned, but we have had to postpone a small number of schools to actually enable that to happen, to get the vaccine in.
But you're confident with the safety of the vaccination programme?
We are confident with the vaccine programme.
It's emerged that Natalie Morton had underlying health problems which probably caused her death. Although a link with the vaccine hasn't been completely ruled out, health bosses remain convinced it's safe. There were mixed views about the vaccine among parents and teenagers in Northampton this afternoon.
I have got a daughter and I was going to let her have it, but what's come out in the press just lately, I just don't know.
If it's going to prevent her getting cervical cancer, then I think I would rather she had it.
I'm still going to go ahead because the chance of it happening to so many people ain't as much, because it's only her that it's happened to out of all the millions of children that's had it.
In many ways, the numbers speak for themselves. According to experts, the chances of developing a life-threatening condition after taking the HPV vaccine is around 1 in a million. That's around 7,000 times lower than the chances of a woman contracting cervical cancer during her lifetime, around 1 in 136. The difficulty for experts, though, is convincing parents of that, especially now that doubts, no matter how small, have been raised. Tom Barton, Anglia News.
A man from Essex and a 13-year-old girl who police say went missing after meeting on the internet have been found in Scotland. James Grenfell from Braintree and Tegan Feekins from Devon had been missing since Friday. They were found this afternoon in Edinburgh after a sighting by a member of the public. Tegan is being looked after by police in Scotland. Police said that a 22-year-old man has been arrested and is now in custody. Next, and parking charges which net our region's hospitals millions of pounds each year could be scrapped.
The Health Secretary, Andy Burnham, told the Labour Party conference that permits for inpatients and their visitors would be phased in over the next 3 years.
Well, our political correspondent Emma Hutchinson is at the conference in Brighton and joins us now. So, Emma, this sounds like it could save people a lot of money.
Well, yes, it could, because anyone who's had to use a hospital car park recently will know it's not exactly cheap. When you look at the amount of money some of the hospitals across our region make in car parking charges, well, it's hundreds of thousands of pounds. Top of the list, Adam Brooks in Cambridge. They took around £2 million in hospital car parking charges over the last year. The Norfolk and Norwich Hospital in Norwich, well, they took £1.2 million. Broomfield in Chelmsford in Essex, they took over £1 million as well. The Health Secretary made this announcement here at the conference in Brighton this morning, but he said it would only apply to inpatients, and that's probably only about 20% of patients using NHS hospitals. So I caught up with one of our local MPs, who's also a health minister, and asked him why this couldn't apply to outpatients as well as inpatients.
Other hospitals do themselves also offer, say, for example, cancer patients. I was a cancer patient myself. My local hospital in Kettering allowed me to park for free when I came in and had my chemo and then left 4 hours later. That's a matter for local hospitals to make those decisions, but let's celebrate the fact that this is a big step forward for people who have to use our hospital services.
So, Emma, how soon can we expect these changes to come in our hospitals?
Well, what the Health Secretary said this morning is that he hopes to bring these changes in within the next 3 years. But of course, there's a cost to this, expected to be around £140 million. The government say they'll find that money from backroom savings. There's also the issue that hospitals do make a lot of decisions for themselves. Foundation hospitals can make those decisions for themselves, and they might not want to do this, so there might need to be primary legislation in the House of Commons to bring this in. And of course, this is a Labour promise. Within the next 9 months, there will be a general election. If Labour lose that general election, well, then this might never happen at all.
Emma, thanks very much indeed. What is it?